as a cohort, in the phage group, we did see in figure A, you can see that there is a significant reduction in C. acnes levels. It may look relatively small, but what it's telling us is that the C. acnes overgrowth beyond a certain threshold elicits inflammation. And if we can just push it below that threshold, then you can see quite a remarkable improvement in acne. Also, because this is such a targeted treatment, it points to the fact that you can actually do this without causing collateral damage. And so dryness, irritation, redness isn't a given when you're using efficacious acne products. In figure B, we actually looked at the female cohort in the placebo and phage group, and we broke them out in responders and non-responders. So non-responders are people whose acne or IgA did not get better, and the responders are those whose acne or IgA lowered during the course of the trial. And firstly, you see that in terms of the placebo responders versus phage responders, so you've got an apple-to-apple correlation, we are seeing that in the phage group, we see a reduction in C. acnes, whereas in the placebo group, we don't, which means that the phage are finding their target and they are doing what we expected them to do. What's really interesting is if you look at the phage group, non-responders versus responders, so the light green versus the dark green in figure B, we see that when we see an acne improvement for the responders, we see a decrease in C. acnes level. And in the non-responders, when we don't see an improvement in acne, you don't see a reduction in C. acnes levels. This indicates that this is the first emergent causal link between C. acnes, the bacterium, and acne. And although we've known that the bacteria is involved in the disease for over 100 years, we've never actually had a modality where we could just knock down the one kind of bacteria and observe its clinical effect. So I think that's a pretty significant